Progress. So we are talking about how to reduce the spread of infection. Any idea what types of infection do we have, and how do we go about to reduce the spread of these infections? Anyone? Okay. So your indicative content for this is to know how to reduce the spread of infection. So the different agents of infection, you know that. There are different ways in which infections are spread. So there are waterborne diseases, there are vector-borne diseases. What is a vector? Can anyone tell me what is a vector? So no answer. So vectors are actually agents that transfer diseases. So let's say for malaria, the vector is a mosquito. For let's say cholera, it is the water that is having the Vibrio cholera in them, the virus that carries the infection. So we are talking about different agents of infection. So there are different organisms that are responsible for carrying infections. They're reservoirs of infection. So what do I mean by reservoir? Anyone? What does a reservoir mean? Okay. So a reservoir is where infections or infectious agents, they breed and they develop. That's a reservoir. So it's a pool of infection, or it's a reservoir is on if it's eliminated, you will have an elimination of the infection in itself from that area only, obviously. And then we are going to talk about people, organisms, spore formation, carriers of infection. I've talked about this. Harm reduction. How do we reduce harm? How do we safeguard and prevent further outbreak from happening? How do we prevent from loss of reputation, illnesses, fines and legal actions, and prevention of all these harms? How training and monitoring and supervision are important. Um, for harm reduction, for reducing the spread of infection. Reporting and recording mechanisms, how important are they? And what is their role? Harm reduction, again, will be discussed in detail. Safety in identification of risk. What is a risk? What is a hazard? Closure of infection areas. How is it important? Why is it important? Management of identified risks and control measures. So our key terminologies here, I asked what is an infectious disease. So it's a disorder that's caused by, or a disease caused by, different organisms. So you have the main organisms are bacteria, viruses, fungi, and parasites. So some organisms live within the body, inside the body, or they might be in your stomach, they might be in your throat, and some of them live on your body, so they don't need to penetrate inside your body. They're sometimes normally harmless, so they're valuable for us. So for instance, you have your some organisms that live in your throat that are valuable there to fight certain infections. But if there's some infectious diseases that can be passed from, but under certain conditions, these organisms may cause diseases. We'll talk about those conditions. Some infectious diseases, they can be passed from person to person. So we'll talk about different ways in which they are transferred. So infectious diseases, sorry, they mostly spread through direct transfer of bacteria, viruses, or other germs from one person to another. You can have them through touching people, So you can have a flu by being close to some person, by kissing someone, someone might cough or sneeze on in that area, and then the person who's not contracted the infection may develop it. Infectious diseases involve Campylobacteria, hepatitis A, B, C, D, E, COVID-19, influenza, measles, meningococcal diseases. Different organisms are responsible for these infectious diseases. So they're called infectious because they can, so one person can have it and then spread the disease to the others. What's the difference between infectious and contagious disease? Any idea? Anyone, any suggestion, any idea?
Contagious, it can go from one person to another. Infectious diseases don't necessarily go from they're not contagious, then don't necessarily go from one person to another if there's no direct contact.
Okay, anyone else? Thank you.
Contagious are also quite a big amount of people could get it like at one time, like a mass illness.
So yeah. So the main difference is that infectious diseases, they're caused by germs that are very minute. You can see them under the microscope. So they're bacteria or viruses. They enter your body and cause trouble. But not all of these infectious diseases spread directly from one person to another. So the infectious diseases that spread from one person to person, they can be called as contagious diseases. But if they do not spread from one person to another, they will not be called. They'll still be an infection, but they're not being transferred from one person to another, so they're not contagious. Some infections, they lead to so there are zoonotic infections also. So some infections that are happening in animals, those are called zoonotic infections. So they can be spread from an animal or an insect, but they're not contagious for other humans. So there's Lyme disease, for example. You can't catch it from someone you're with or pass it on to someone else. It only comes from a bite of an infected tick that is there on the animal. And it's just that you can't transfer it further on. So it's not a contagious disease. So contagious diseases are very dangerous. Infections are dangerous, but then you don't, in the contagious form, you actually spread the infection. And this is how you have flus, you have colds, you have streptococcal throat infections, which spread from person to person, and there's several ways in which they can be spread. One way is through direct contact, touching someone or kissing a person who has the infection. Another way is when an infectious microbe travels from the air. So there's certain ways a person sneezes or coughs that those organisms live outside that environment, outside that person's body, and then they're there in the environment. So when the other person who's well, they come in contact with that environment, they can then contract that virus. People sometimes they get contagious diseases by touching or using something that's infected because of another person's use. Sharing straws with someone, sharing blades with someone, taking a shower after someone who has athlete's foot. You can have that. Sexually transmitted diseases are very common through different forms of sex. So they can also spread infections. They're infections and they can be contagious. So causes of spread. So different organisms have different ways of spreading infections. So we'll talk about microscopic living things, which are known as germs. You can only see them, again, as I said, they're around us, and they're very small to be seen through the naked eye. Some of these could cause disease in people, and there are 4 major types. So we've talked bacteria, viruses, fungi, and what's the 4th one, if anyone was listening? What's the 4th organism? Parasites. Okay, so bacteria, they're found almost everywhere. So within the body, outside the body, some bacteria, as I said, they're helpful. They protect the body against certain disruptions. So you have your normal commensals, they're called normal commensals, that they live within your body. They live normally within the body. So you have your vaginal flora, that's there against infections, to fight infections. You have your throat flora, your oral flora, that's there to protect against certain infections. So they live in close contact with us in an environment without causing any harm. But some bacteria, they can infect the body and cause disease. So these are streptococcal sore throat. You have pertussis, which causes whooping cough, meningococcal disease, which is very dangerous. And there's certain people who these infections are seen in most commonly. So we'll talk about what happens, why are these people more commonly having to deal with these infections. Viruses, they can only grow and reproduce inside other living cells. Those living people or those living cells are called hosts. So for instance, there's a virus that lives inside me, so I'm the host to that virus. There are certain viruses that can live in dogs. So there's those, can anyone recall any virus that lives in a dog?
Rabies.
Very good. Rabies. So rabies can be spread from the dog to us, obviously. And most viruses cannot survive for very long outside their host cell, so they'll die. They can't live in natural environments. When viruses, they enter our body, they can multiply and cause diseases, illnesses, and these diseases, they can manifest as different ways. In different ways, you can have common flu, you can have common cold, gastroenteritis. So different viruses have different places to work on. You have varicella. So varicella virus will only cause chickenpox. It's not going to cause gastroenteritis. It may be a complication of your chickenpox. Measles and influenza will definitely cause flu and measles infection also. Then we have fungi. You have protozoa. So fungi are again a group of organisms. These include yeast, molds, and mushrooms. You have them very common in damp areas, in warm places. So many fungi, they're edible. Yeah.
That has been our history.
Sorry?
We take steps of faith based on the word of God. And the God we serve has never failed us yet, and he will never fail us. And he will never fail you as well in the name of Jesus. And as a result of growth, God is also taking us a step further. By the grace of God, we have just acquired a 5.9 acre property.
Yes.
5.9 acre property in Blakely. I don't want to tell you the price.
Please mute. It's Esther, tell her to mute.
What we were paying for that.
I'll just do that. Just
Oh, you mute her.
I understand. Church pay.
It's Esther.
Pounds.
That's done. I was thinking that they're talking to me. They're talking about some fungi or protozoa. I thought they wanted to add to this. I'm sorry. I kept struggling to understand what they're saying. Okay, so fungi, and thank you for letting me know to mute. Yeah. So they're fungi that may be edible mushrooms. Baker's yeast, they're not dangerous, but some can cause disease also. So you have Tinea corporis, which causes ringworm. You have Tinea pedis, which causes athlete's foot, and then Candida, which causes thrush in different places within the body. Protozoa, they are microscopic living things, and they thrive on moisture. They live on moisture, often spread through water. So water is the vector for them to spread. So a vector, like for instance, if it's malaria, it's the malarial, it's the mosquito that transfers the malarial parasite from one person to the other. So some protozoa, they can cause intestinal infections, including diarrhea, you have nausea, stomach upsets. You have cryptosporidium, you have giardia, lamblia. These can spread through contaminated drinking water. So the water is the vector, and the reservoir also, where the protozoa are living and they're breeding. Other sources of infection, they're common also. So there are different other germs such as roundworm and hookworm that can be caused by parasites, which we've not talked earlier in the categories. They're mites. So these live on your bodies. They cannot live within your bodies. So they call scabies. Insects, again, head lice would live on the surface of your body. They can cause infestation, and scratching may lead to secondary bacterial infections. How do they spread? Different organisms have different ways of spreading. So, for instance, if you have the 6 key stages, basically for them to, which is known as a chain of infection. So, what we need to know is, why do we need to know them in these 6 stages? Because if we break any part in this chain, if we give a break in this chain of infection, we can stop the infection from spreading. So our main objective is to stop the infection from spreading. So the first step is the harmful pathogen that causes the infection. The second is the environment that allows the pathogen to multiply. So if we get rid of this environment, that chain is broken down. Transportation through that vector that carries this pathogen from one person to another, or from one place to another. In case of water, it's viruses that are carried. So if we remove that water, get rid of mosquitoes, let's say, that transportation would not happen, and then the infection malaria could not spread from one person to another. A route into the body that allows the pathogen to enter. This is very important. So what are the routes? If you're wearing a face mask, you might not contract the common flu. So that's a route for entry, your nose and your throat. If you're blocking that, the chain obviously stops there. A route out of the body allows the pathogen to exist. So within the hair, let's say there's lice. If you're clearing that up, you're again reducing the chances of spread. The pathogen then enters the body of another person. So if you're keeping a proper distance, you're removing the chances of spread of infection. This is a description of different types of pathogens and how they cause infection. So you can always have a look at it. This chart is very helpful. So for instance, for bacteria, you have how do they multiply? It's time. They have different nutrients, they have moisture and temperature that is ideal for them to multiply in large numbers. Antibiotics and immunization can kill them, control most bacteria, but some of them would not be killed. Viruses, they're smaller than bacteria, can only survive within the human body, do not live long outside. Antiviral drugs and immunization can kill them. Fungi appear as molds or yeast. We've talked about them earlier, and the treatments are available for killing and controlling fungi. So why is it important to prevent and control spread of infection? Obviously, it is essential to ensure that people stay healthy. So there's legislation that says that why spreading of infection is so important. Any idea, anyone, if you've, what are the different ways in which we can control spread of infection? Anyone?
Like using protective gears, like hand gloves, apron, and using hand sanitizers.
Yes, applying sanitizers. What else?
Hygienically, washing our hands regularly with soap.
Making people aware. Awareness is a very big problem. Not people are aware of how diseases are spread. So making people aware of what the illness is, how it's caused, helps them be safer and keep themselves away from the disease.
Yes, raising awareness is very important. Anything else? So we'll talk about why is it important. So we talked about legislation, yeah. So there's a pathogen that lives in a reservoir. Let's say it's a water pond of water that the pathogen lives in. There's a portal of exit so that the reservoir exits there. There should be a way of it for exiting. There's a mean of transmission. So let's say the water is being transmitted from one person to another, there'll be a means of transmission. There'll be a portal of entry. What's the portal of entry for water? The oral cavity, obviously. There's going to be a susceptible host. So every person will not contract that infection. There's certain people who will and certain people who will not contract. So it depends upon your immunity, basically. And there's a person who is perfectly immune, perfectly sanitized, is in perfect health condition, but once that health condition is deteriorated, for instance, if that person contracts an illness or has a disease like HIV AIDS or any other infection that reduces their immunity, they would then become susceptible hosts. So not all hosts are susceptible. This is what I was focusing on. So the primary role of infection prevention program will be to reduce the risk of hospital-acquired infections. So you're protecting your patients, protecting employees, health sciences students, any volunteers who are working, any visitors. And the functions of an infection prevention control program, they're different according to different institutions, but they're mostly divided into the following areas. So you have surveillance. Surveillance comes from survey, which is an ongoing process in which you're taking data and analyzing the rise and fall of the infection. Isolation of patients with transmissible pathogens. So that's your second step. So you've done your survey and then you're isolating your patients who are most at risk of spreading the infection, and then isolating, obviously limiting the spread of infection, breaking the chain of infection. Outbreak investigation and management is very important. This is whistleblowing. So you have to investigate an outbreak, where it happened, how many people were involved, what was the agent, and this is how you will manage it. Education, very important. Communication, as one of you said correctly, is very important so that it prevents the other people from contracting the same infection. Employee health is very important. Why is it important, employee health? Can anyone tell?
Can you rephrase that question, please?
Yeah,
Employee
I have
health.
just, yeah, employee health. Why is employee health important? Why is it mentioned in an infection program, prevention program?
Because it enhances the productivity of any organization.
Yes. So has anyone heard of or has anyone had an experience of having testing done before joining an institute, so that you know that you did not have any disease before, and if you contract a certain occupational health disease, that can be brought forward, and then that could be highlighted that you did not have that infection or that disease earlier, and that is only as a result of the infection. So employee health needs to be assessed this is why I was focusing on this. And then the monitoring and management of institutional microbial use and antibiotic resistance. This is very important. So you need to monitor this and manage your institutions wherever you're working. What's your policy of using antimicrobials and antibiotics? Antibiotic resistance is obviously some resistance that is offered by organisms when you use antibiotics the way they should not be used. So the proper way is to complete your dose. If you do not complete your dose, and if you skip your doses, if you're not taking them in proper time, the antibiotics, the bacteria, they're very clever. They change their strategy and they become more resistant. So you'll have to apply different other antibiotics unless, and if that keeps happening, there'll be a point where there'll be no antibiotic working. That also happens. The development of infection prevention policies should be there within your program, and environmental hygiene and new product evaluation should be there. So this is there are certain legislations. We'll talk a bit about them, not in too much of detail. You can have a look at them later on. So you have your Health and Safety at Work Act, 1974. So this acts on all current health and safety regulations. So it's also known as the Enabling Act because it enables other health and safety regulations to be made, promotes health, safety, and well-being of everyone who's involved in that organization. So it established the DiHSC, which is the Health and Safety Executive. So it's a regulator for health, safety, and welfare of people working in the UK. The key duties and responsibilities, they were established of all employers and employees in the work settings, and it requires employers to have a written health and safety policy and procedure in place, including those for infection prevention and control. Public Health Act in 1984, and it's amended by the Health and Social Care Act 2008 and the Public Health Regulations in 1988. So this act is concerned with prevention. So whenever you have a Public Health Control of Disease Act, it's going to be a global condition, or it's going to be an epidemic condition, which would involve the public rather than just few people. So it requires that infection and diseases are reported. You're reporting, outbreak investigations are there, so the spread of infection and disease can be managed and monitored effectively and regularly. So these regulations set out a list of highly infectious diseases. So there's some notifiable diseases that you will have to notify to the UK government agencies in order to mitigate them. Food Safety Act obviously has got to do with the food safety and food hygiene regulations. You have the Food Standard Act in 1999. So the Food Safety Act will work on all current food safety legislations. They provide a framework. Whoever's not abiding by it would be not regulated, and then their work would, this is mostly for those agencies that are dealing with food. And Food Standards Act was established, it established the Food Standards Agency to monitor food safety and standards. Regulations are set for different processes where food is handled, prepared, cooked, and served. Personal protective equipment, PPEs at work regulation, they were very helpful in working in the hospitals and also during COVID-19. So gloves and aprons are there to protect against infections. This may require employers to ensure that the PPE is available and it's in good condition, and the employees must be able to use these PPEs. They require employees to comply with their employers' agreed ways of working, and when using and in disposing of PPEs during activities. Workplace regulations is very important. So it's ensuring that the environment is clean and free from debris, and that the equipment used with individuals is clean before and after use, so in order to minimize infections. Management of health safety at work regulations. This is again got to do with work, includes the risk from harmful pathogens being transferred from one work activity to another. Employers with 5 or more employees who are required to record the findings of their risk assessment. So employees are also required to take care of their own and others' health and safety, and they should be adopting practices that are safe and not unhealthy for the others. So control of substance hazards to hazardous to health regulations. This requires employers and employees to manage risk, and that harmful pathogens can cause certain infections and diseases that can spread. It also requires employers and employees to use, store, and manage hazardous substances, cleaning agents, for instance, in a controlled way and in a safe way. Environmental protection regulations, they're there to monitor controlled waste and monitor and control waste that is disposed of safely by setting out how waste is awaiting disposal and how it must be stored. Hazardous waste regulations, again, this is again to do with different used dressings, sharps, and different procedures that have equipment that could be contaminated. So how would that be disposed of? Health and Social Care Act 2008. This has a code of practice that applies to the NHS and all providers and adult social care in England. It sets out how providers must comply with infection prevention requirements in order to ensure high levels of cleanliness. There'll be different standards to prevent risk, to reduce risk of infections from being spread. Reporting of injuries, diseases, and dangerous occurrences. This is again apart from infections. So these are injuries that can cause death, certain serious injuries that are reportable work-related illnesses, and certain dangerous occurrences, like for instance, self-harm should be reported. Infection prevention and control, this in that it includes employers reporting some work-related diseases to health and safety executive or local authorities. Can you stop infections? So obviously, breaking the chain of infection is one way. How can you stop them? We'll talk about this. So there are many ways. Perform hand hygiene, keep up to date with your immunization. Health education is very important. Remember cough and sneeze etiquettes that should be there always, and that should be communicated to everyone. Clean surfaces regularly. Keep unwell children at home as much as possible so that there's limiting the spread of infection. Other methods are breaking the chain of infection and inclusion periods. How long would you recommend that a person remains excluded from that setting in order to reduce spread of infection? So then we're talking about controlling the spread of infection. How is that going to happen? The basic, there's standard infection control procedures. They can be used for all workers. Then you have the infection prevention and control IPC measures that are necessary to reduce the risk of spreading infection. So IPC, they include hand hygiene, respiratory and cough hygiene, your PPEs that you use, safe management of care equipment, safe management of the environment, management of laundry, management of blood and body fluid spills, waste management, and management of exposure. So all of these are infection prevention and control measures, and these all have a role in reducing the spread of infection. How would you reduce the spread of infection? So you have hand hygiene. Which infections would you reduce their chances of spread by hand hygiene? Can anyone talk about this?
Colds.
Yeah, what else?
COVID. Any respiratory diseases.
Anything else? the GI tract, the gastrointestinal tract. Those are also spread orally, isn't it? So you have a chance of limiting those spreads also if you're performing hand hygiene. So there's certain examples how to reduce infection. So hand hygiene, wash your hands before and after you start any work. So you're keeping this as a practice. So you're washing, eating and drinking, going to the toilet, handling waste. Always wash your hands, obviously, before eating and drinking and after eating and drinking. Going to the toilet, you do it after. Handling waste, you do it after. Keep your hands moisturized so the skin, if it becomes too dry and flaky, your chances of carrying out, obviously, those infectious agents can spread into your body through those dried cracks. Ensure any cuts in your hands, they're covered so that, again, you do not have that infection penetrating in your body. Do not wear rings, watches while you're carrying out activities, because these will then not be hygienic and they would spread infections also. Personal protective equipment, only use and dispose of them once you've been trained to do so. There's a proper training to do that. And in order to limit the spread of infection, ensure that you have selected and correct size of PPEs. Gloves that are too small may rip, and gloves that are too big may slip off. So you're not performing your activity, and those are being hindered. Those PPEs are hindering your activities. Gloves are color-coded for different uses. White is for supporting individuals with their personal hygiene. Blue is when handling food, for instance. Always wash your hands before and after putting on and disposing of gloves, because you're getting in contact with them anyway, so that infection can spread through your hands also. Cleaning the environment, so the surfaces, they're cleaned, washed, vacuumed regularly. Cleaning of floors, furnishings, they should be there on a regular basis. Keep the environment clean by disposing of waste safely, not leaving debris spilled over on surfaces. You can have rats and flies that could support harmful pathogens from being transported from one place to another. They're working as agents in transportation of infections. Always use designated washing facilities so that you're not using other washing areas to wash contaminated hands. Always wear PPE and carry out effective hand hygiene before and after cleaning to prevent the spread of harmful pathogens. Cleaning spillages, so clean spillages if you've been trained to do so. Always wear PPE when you're cleaning, when you're handling them. Only use cleaning materials that are appropriate for that surface. And alert others to the spillage by displaying clear signs. Otherwise, they would be contaminated also. Cleaning body fluids. So if you're dealing with body fluids, only clean them if you've been trained to do so. Always wear PPEs, protect yourself first and then the others. Cleaning body surface, clean body surfaces as soon as the spillage has been occurred. That reduces risk. You could have appropriate disposal methods like a red bag for soiled linen. A yellow bag is used mostly for dressing. Cleaning the equipment is very important. So making sure that the equipment that you are using is clean and there are no harmful pathogens before being used on anyone else. So always wear PPE when cleaning equipment, obviously. Safe handling and disposal of waste. So there's certain clinical waste that you have that is high risk. Use dressings are there. You have certain incontinence pads that may be disposed of in yellow bags because you will you'll be incinerating this, destroying this waste totally. Wear PPEs again before handling them. Safe handling and disposal of sharps. So you need to have a sharps bin always. Body fluids such as blood that are contaminated, then infection may transfer. So you may have hepatitis because of a needle stick injury. So always make sure to handle them with care. Then you're analyzing how an outbreak of infection would be managed in a health and social care setting. How to manage an outbreak. in a care home. So COVID-19 pandemic was highlighted in care homes that enforce rigorous rules to be implemented there. It was established that a third of all fatalities from COVID-19 pandemic had been in residents of care homes because they're already living in difficult situations. An outbreak of infection in a care home can be very serious. There's so many other people who are living there. It can be life-threatening. And they're frail people already. They're not very healthy people who are living in those areas, and their immune systems are not too good. And then you're saying that if you have these strict procedures and practices in place, then you can then prevent these infections from happening. What's classified as an outbreak? So an outbreak occurs when two or more people, so it has to be more than one, it's two or more people acquire the same infection from the same source. So let's say an outbreak of cholera. So the cholera, it should be Vibrio cholera, that is the agent that is spreading the infection. It should be the same food or the same water that more than one person has consumed. That is known as an outbreak. Care home staff, they must be trained in infection control or outbreak in preventions. So that outbreak has happened, how do you prevent it from spreading? Because outbreaks have a tendency of spreading really fast. They're a smaller version of what a pandemic, you have an outbreak first, and then if it's not controlled, it becomes an epidemic. And then further on, it can become a pandemic to involve the whole of the globe. Which doesn't happen because outbreaks, they're sometimes very small and they can be preserved at that point. Bringing an outbreak under control quickly is very important in a care home because many residents will be more vulnerable to infections because of compromised immune systems. So when an infection happens, an outbreak can occur quickly because obviously there are different people who are there, different visitors who are there, so they're not isolated. And medically care home residents are often at greater risk of contracting several other infections also, apart from that, only that outbreak. Once an infection is present, it can spread throughout a care home in a variety of ways. So you can have physical contact from one person to another, or being breathed in when the infection is airborne. So airborne infections are when, obviously, the infection is remaining in the air or within surrounding material. So you have different, you have the floor, the carpets that are full of infection. So you have different ways in which the infection can be spread from one person to another. So how are these prevented or how are these controlled? So you have prevention, preparedness, detection, and management, PPDM. So prevention is when you know, obviously it's better than cure. All care home staff should follow standard procedures or standard infection control precautions. So some precautions should be taken to prevent include hand washing, which should be frequent, wearing protective clothing like gloves and aprons, promoting sneezing and coughing hygiene, assessing new residents for infection. Preparedness, the second part, obviously you're prepared for an outbreak to happen. If you're prepared, that makes you geared towards prevention. This allows everyone to work together in order to prevent an infection outbreak from happening. Outbreaks most commonly occur during autumn and winter. So it is because it is colder and more people want to stay indoors because of the heating that is only possible indoors. So and then you close up windows and doors also to prevent it from being cold inside. So prepare for these months. It is recommended to that all people over 65 years and all health and social care workers are given the flu vaccine in order to reduce spread of infection within care homes. Detection. So you have rapid lateral flow tests, PCR testing. So if you detect earlier, you know where to be isolate, which people to isolate, and then from further spreading infections. It is important, and then you're giving those people treatment, also appropriate treatment when you're testing them. It is important that care home staff remain vigilant at looking out for signs of a possible outbreak as quickly as possible. so that it's brought under control. 2 or more people, if they're presenting with the same symptoms, then care home staff should inform the manager of the care home staff, residents, and the relatives of those who are sick. Management, again, once the infection has been detected through any technique that's been mentioned earlier, you'll have to manage and to control and minimize the number of residents who become unwell. So you're limiting the spread of infection. So you're suspending visitors from attending that place. You're stopping admissions and transfers of patients so that they're not spreading the infection, using more protective equipment, using disinfectants, allocating staff to specific residents to prevent cross-infection, decontaminating items touched by infected residents. Then you assess how risk assessment can contribute to reduce spread of infection. So you're defining risk. So risk is something that is always there. It has a potential of becoming out of control. So the risk in relation to infection, it's the likelihood that the infection may spread rapidly from one person to another and cause serious harm and cause fatalities also. So the likelihood of infection spreading rapidly, it will depend upon several factors. And if you know those factors, that is how you can deal with those factors and minimize that infection spread. So it's how quickly, how effective the practices are applied to controlling infection. That's one of the main factors. How many people live and work in the area where infection was identified. There are several other factors also, but these are just a few. In addition to this, there's a likelihood of infection spreading, which is increased by the people themselves. So an older individual who has a weak immune system is not very up to date. Obviously, they're up to date, but their immune systems are still weak. They'll contract the infection more rapidly than another person whose immunity is not compromised. Influenza, for instance, and pneumonia, they're highly infectious and among people with weaker immune systems, or people who have cancer, chest infection are more common in them. So potential risk of infection and reasons for potential risk. So the risk, one risk could be of infection could be a group living. So people live together and they're more in close proximity to each other to spread the infection. Caring for individuals who have infection. So not all people who are out there would have the infection, but if you're caring for individuals who have infections, working in a setting, you're more prone to have these infections and carry and spread these infections. Obviously, if you're not, if those people are, they don't adhere to, you can stop this obviously by even if you're working there, you could have personal hygiene practices. You can have proper eating, drinking, proper procedures to use the toilet. So if you're doing these activities, you're more at risk, but then knowing your increased risk, you would have to have increased efforts. Handling waste. So people who handle waste, they're more at risk of contracting infections and harmful pathogens. Handling laundry. So laundry that is contaminated, you have more chances of contracting infections and spreading them. People who handle shops, they're more at risk of needle stick injuries. People who clean or remove dirt, they are more at risk of having getting infected. What is an infection control risk assessment? This law requires organizations to carry out infection control risk assessments in order to protect the health and safety of employees and the wider public. So these assessments should be carried out regularly in workplaces. What these hazards and risks look like, they can vary significantly depending upon the organization type. In care homes, you're welcoming a new resident into the home that poses a risk of infection. So you don't know what infections they have. And close friends and family that visit the residents in homes, care homes, they're also a risk. They're posing they're themselves a risk for infection. Infection control risk assessment will involve identifying risks, tasks or activities that carry the risk of introducing or spreading infection, identifying people who may be most vulnerable for spreading the infection, evaluating the risks and implementing precautions and controls, keeping thorough and accurate records of every risk assessment. So there's a scenario, we can discuss this later on. No, okay, these are the references. I'll just go through this scenario and then we're done. Just a minute. I'll just be taking a minute. I'm just sharing this scenario with you. So here there's a toolkit. It's, you can always make use of research. So there's this health-associated infection, HAI, outbreak investigation toolkit that you can use in different settings in healthcare, sorry. So this provides systematic data collection as part of health-associated infections. So this you have this user guide here, which we can access here. Okay. Can everyone see this guide? I hope you can see it. So this is a guide that tells you about how an infection can be controlled or an outbreak can be controlled. It's very valuable in which you have different cases here, and you have a whole list of inpatient admissions form. And this whole guide is there to help you develop this form. So you have the admission sources, which you are dealing with home, you have long-term acute care, hospital, nursing homes, rehabilitation. So whichever place that you're working in, you can include that. And you can talk about the status of hospitalization, if they're still hospitalized, if they're discharged, and different diagnoses at that time. Outpatient records can be there. So date that started, you have this, they've started in the hospital, procedures of infusion or infusion, whatever's included, additional visit information, this can be there. Medical histories, they're taken in a very good form. So you can use these forms also in order to keep yourself updated with every case. Then you have clinical causes, site of infection, you have date of illness onset, different categories are here, previous history of infection, date of positive culture, antimicrobial therapy, which was given, vital signs. So the list of things that you can take from this it's quite extensive, but then you can tailor make it according to your organization and work on the outbreak investigation. So this is very helpful, this healthcare associated infection outbreak investigation. And it is a guide for completing on your end regarding any outbreak that happens in your setting. Any questions from the talk that we've had so far?
But to my belief, there are some infections that you need to isolate the patients. Are there no
Yes.
infections like that?
Yes, we've talked about isolation of patients. I didn't get your question, sorry.
I said, if for instance somebody is having an hepatitis B now, will he or she be isolated? Will he or she be isolated?
Oh, hepatitis B. Yeah, so they it depends how the infection actually spreads. So if the spread of infection is bloodborne, let's say, you'll have to take care of the blood products of your of the person who's involved. So if this hepatitis B infection doesn't spread from one person to another, it has different ways. So hepatitis A, for instance, it spreads through consuming infected stuff, infected food, infected water. So that becomes more of like if you're going close to a person. But if there's a person who has hepatitis B or C, that person cannot spread the infection unless they have certain routes of spread of infection. So if you're having a needle stick injury because of that needle being infected from that person, then you can have a chance of spreading, that infection can spread to you. But yes, they have to be isolated to some extent. But then that infection remains active for some time. And then when they're under proper treatment, it depends upon how infectious they are. But different organisms, they spread in different ways. So hepatitis B will not spread if you're just sitting with one person. It's not an airborne infection. You know what I mean? So it's only going to spread through blood-borne products. So it depends upon, for instance, if there's a COVID-19 patient, you will isolate that patient. You will keep them away from the rest of the public because that has a greater chance of being spread orally or from airborne infection. So that has a chance of being more contagious.
Yeah, thank you. I understand now.
Okay. Yeah. Any other questions? So if there are no questions, the recording will be shared with you.
Excuse me, the one for Sunday, I've not seen the recording from Sunday last week. It's not been put on the wall.
Yeah. If you could just email on the group, on the learner's email ID, I'll just share it with you.
But they usually tell us to put it on the WhatsApp group so that they share it on it.
Okay. I'll ask them. Otherwise, there this link that you can
But
use.
now they told us they'll be putting every recording will be put on the WhatsApp group, but we don't get it like that.
Okay, I'll let them know. So this is the learnerwork@ukversity.co.uk. Okay.
Yeah,
I'll make sure I'll ask them to share the recordings. No worries. Thank you for your time. Thank you and have a lovely day.
Same
Bye.
with you. Thank you. Bye.
Thank you. Thank you. Bye. Bye.